Thank you, Trung. And thank you all for being here. The big picture problem that I'm most interested in is to be able to automatically detect any man-made object from any medical image. And these objects can be stents, implants, surgical instruments, or needles. And then what I'd like to be able to do is take that knowledge of what and where is in the image and be able to use it to advance healthcare. So within this big picture, what I'm going to talk to you about today is how we can use deep learning techniques from AI to be able to find tips of needles in ultrasound images to make liver biopsies safer for the patient and easier for the physician. And in the process, we will also start to pay attention to personalized biopsies. Okay, so the pictures that you see here are from an elderly patient with two masses, one in the pancreas and one in the liver, and the liver mass is suspected to be metastasis from the presumed pancreatic cancer. My clinical partner, Dr. Paul Shin, did this biopsy to both diagnose and stage the cancer. The white arrow on the picture shows you the dark, it points to a dark, about 2 centimeter mass, which is, it's below the liver dome, and then you can see, so it's in the liver, and the red arrow shows the needle, which is inside the abdominal wall, but it hasn't yet is not in the liver yet. Okay, so this is just to give you an idea of what an ultrasound image looks like. Okay, so now here you see we're later in the procedure, and right by the white arrow, you'll see the black mass, the tumor. So this is now, the needle is approaching the mass and then in the mass. And the red is where you're gonna see a bright line turning into a dot. That's what the needle is, okay? So if you've started to maybe get a handle on what a needle and a needle tip looks like for the physician during ultrasound biopsy, let me tell you that this particular needle, this is a 17 gauge, a relatively thick needle that's being used for this biopsy. So most needles in procedures are even finer, thinner than this, so the problem of tracking the needle and knowing when it's approaching the mass is even harder than what we're seeing here. How are we going to make this simpler? So what we would like to do, okay, so here are pictures that you see from a different patient, and on the left is a needle that you can see relatively clearly, and on the right is a needle you cannot see as well. So what we would like to do is to use methods from artificial intelligence so that the physician can see the needle in its entire length, continually, fully, and with the tip clearly marked when it's visible in the image. And we want this to happen no matter how poor the ultrasound quality is, and it shouldn't be dependent on the operator experience. Okay, so this is what we're proposing to do. What you're seeing is a green line showing where the needle is and the red dot showing where the needle tip is. On the image on the left, the dot is there indicating very clearly, unambiguously, that the tip is indeed in this ultrasound image. And on the image on the right, the tip is not yet in plane. This is the type of unequivocal needle guidance that we want to be able to provide. Okay, so benefits of being able to do this. If we can make this available to all physicians doing needle-guided biopsies, you can imagine that we would have better accuracy and safety from a physician's point of view. This would reduce the bleeding and complications that physicians worry the most about in doing liver biopsies. Shorter procedure times and also a shorter duration, the learning curve for physicians is something that we hope to be able to gain from this. And for the physicians. And for the patients, this opens up another avenue which is not part of clinical medicine today, clinical practice of these procedures today, but what this opens up is the possibility of noting down precisely where the tissue sample was acquired, putting it in their medical record, so that subsequently when genetic and molecular analysis takes place on these tissue samples, it can be correlated back to where on the anatomy that sample was acquired. And this is what I mean by opening the doors to precise tissue sampling leading to precision medicine for these patients. Okay, so how are we going to draw these lines and dots? Surprisingly, we're going to use deep neural networks to achieve the solution. And this is based on work. For years now, we have been finding needles in image stacks, so to speak. And so we have developed a wide array of algorithms. Most recently, we published one on finding prostate biopsy needles in MRI images. And that was published just a few months ago in an IEEE journal. And what we would like to propose, what is suitable for this particular problem, is to have a needle button, a button that's labeled needle, on the ultrasound display itself, similar to those of you who are familiar with ultrasound, so the way the Doppler button exists today. The physician presses the button, and as long as the button is pressed, Doppler information is shown on the screen. So this is what we want to do, is have a needle button, so as long as that's pressed, if there's a needle or a tip in the image, that will automatically get highlighted. And if the physician doesn't want to see it, they can turn that off. So there is no change expected in the workflow and no additional hardware needed. Why do we care about these particular aspects or characteristics of the solution? Because we have designed the solution to beat the competition. There are some very, very brilliantly engineered systems on the market available for ultrasound-guided biopsies that are not being used at all. These are navigation systems where either the needle itself or the transducer is instrumented with coils or sensors, or there are even much simpler guides through which needles can be introduced. The reality is 99% or more procedures get done freehand, because this is a low-cost procedure, which is very fast for the most part, and it gives us no time. There is no room for adding time or complexity or incremental cost to it. So this is what I would like to point out here. There's 1 million biopsies going on, or nearly 1 million biopsies that take place today for the liver using ultrasound. This number is projected to grow at about 4% a year. And the majority of these biopsies are focal, either for primary cancers like hepatoma or for metastases from cancers in other parts of the body. And success of these procedures continues to be delivering the needle safely to the target without any bleeding or complications, and being able to remove that sample. And that's what we are proposing to do. The next steps here at the meeting are to talk with any ultrasound manufacturers who are interested in hosting such a solution on their platform. And for us on the science and clinical side is we've started working on this to collect very carefully curated training data from about 3,000 patients. And this is where we're going to use navigation systems to help us get this very precise training data, and then be able to build our deep learning system around that. Thank you very much, and I'll be available outside if anyone has questions.